I'm Kylie from Kylie's Couch. Today I want to talk to you about depression, and I want to clarify a few things about what depression is and what depression isn't. We all have low moods. None of us are stable and consistent all of the time, and things affect us in our lives and bring us down. And it's very important to clarify that just because you're feeling sad or just because you are experiencing a low mood does not mean that you are depressed. Apart from actually feeling bad more days than not and feeling sad and feeling low, you also find that people who are depressed have a real lack of interest, or they don't take pleasure in things in their lives. What people don't know about depression is that it also affects you physiologically. So depression has an effect on your appetite. For some people, they get an increased appetite or a decreased appetite. There's also effects to sleep patterns. So you can find that some people, when they're depressed, they sleep too much. That's called hyposomnia. They want to stay in bed all day long. They don't want to get out of bed. They sleep too much. Some people have insomnia, so they can't sleep. Then there's other symptoms like excessive guilt or worthlessness, and there's also low energy, feeling like you don't want to do anything. And I'm not going to go through all the symptoms. You can research it, but the problem is that we all experience some of those symptoms at some point in our lives. The other most important thing about a depression versus a low mood or an everyday sadness is that a depression will interfere with your functioning, and it will impair your functioning in either your social or occupational life. So either you're unable to work, this is often due to a lack of concentration, which is also caused by depression, or a difficulty with relationships. Perhaps you're blowing up with people all the time, because irritability is also a symptom of depression. But the point is that the symptoms are radically affecting your ability to cope with life's challenges and radically affecting your relationships and your ability to function. The other most important thing to remember is that you cannot be diagnosed with depression if you have recently lost someone. So if there is a real reason for bereavement, then it wouldn't be diagnosed as a depression, because you are experiencing all of those symptoms as part of a bereavement, as part of a sense of loss and grief for someone that has passed away. And the same goes for any major adjustment in life. So we spoke before about expats and how when you move to a different country you experience a lot of adjustment. Well, sometimes during those periods of adjustment you experience some of these symptoms that I've described, but it's not because you're depressed, it's because you're adjusting to something that's radically altered your life and made it really hard for you to cope in the same way you were coping before. So all of these things taken into consideration, we as professionals have to look at the person and their history and their symptoms and try to determine whether this is an actual clinical depression. Now, if you think you have a clinical depression, the first thing you need to do is contact a health professional. So you can contact a medical doctor, a psychiatrist, or a psychologist. Each one of those professionals is going to give you different advice, or possibly give you different advice, and all have different treatment options for you. So if you go to the medical practitioners, they will treat your depression with antidepressants. They will give you medication, and medication does alleviate the symptoms of depression. But we as psychologists know that actually the symptoms of depression absolutely can be dealt with in therapy. So very often the symptoms are just a sort of alarm bell that tells you there's something going on here with you. And when you go to therapy, you explore those feelings, you explore what's happening in your life. It's mostly the case that there's negative self-beliefs that are creating these terrible thoughts and feelings. And for some people, it's about a negative relationship that they are in that is detrimental to their well-being. But whatever the case is, therapy actually looks at trying to explore and understand these symptoms rather than to just treat them. If you have any questions, you're welcome to email me. You can find me on my blog. You can write to me on social media, get hold of me, find out if there's something that you missed or something that you want to get more information about. I'm here for you. And if there's any questions you have about depression specifically, please let me know as well. Okay, thanks. Bye.